As most people know, I've got a bee in my bonnet about tort reform. I think that we need legal reform big time if we want to save any money on health care. Come on in, please. Tommy Thompson, who was previously an HHS Secretary. Governor, welcome back. It's good to see you, sir.
Well, it's always a pleasure to be on your program, Stuart, and it's always good to hear you because you articulate a message that is badly needed and has common sense, so thank you.
Would you like a half hour on the show? You take it away, lad. No, seriously, I mean, I do have this. I really do think that tort reform is really, really important if we want to try and contain and bring down the costs of health care. Do you see any possibility that we'll get tort reform before we're done with Obamacare?
I'm hopeful. I'm not sure it's going to be in the first bill, but I'm fairly confident it will be in the second bill. Tort reform is badly needed. I can tell you, and I can attest to it, that when I was governor of the state of Wisconsin, we put a cap at $350,000 on punitive damages, and we were able to successfully drive down insurance rates. Our sister state to the south, Illinois, did not. Their rates went up, and it was easy to see doctors traveling across the state line to practice in Wisconsin because of that particular issue. So I know that it saves costs, I know that it helps doctors, and it does drive down health care costs. When you're talking about health care, you've got to look at anything and everything in order to drive down costs, and tort reform is just one of many.
Yes.